Well, as Breast Cancer Awareness Month wraps up, we're taking a look at breast cancer in men. It's not something we often think happens, but it does. Joining us here today to talk more about this serious issue is Dr. Miho Teruya Dougherty from the Willamette Valley Cancer Institute. Thank you so much for joining us today.
Thank you for having me.
And let's just jump right in. So this isn't something a lot of people even think about during Breast Cancer Awareness Month, but it is an issue. How does this affect men, and how many men does this affect?
Well, so you're right. Breast cancer in men is not as common as women. It's about 0.5 to 1% of breast cancer diagnosed each year. So it's about 100 times less common than it is in women. Lifetime risk for men is about 1 in 1,000 compared to 1 in 8 in women. So quite a difference there.
And so I know one of the things that in doing just a little bit of reading on it that I found is that a lot of men, part of the problem is that they don't get checked right away, or they don't think they need to get checked right away.
Sure.
What are some of the sort of issues that you see with men who maybe don't come forward early enough to spot this?
I think a lot of men, I guess breast cancer is a disease for women mainly. So men are embarrassed about it too. So a lot of times they'll wait forever to come in to see a physician, especially a breast cancer doctor, because they don't want to admit that they might have breast cancer. So delay in diagnosis is one thing. So it tends to be men who get diagnosed with breast cancer tend to be older than women in general.
So what are the best ways for men to sort of get checked? I mean, is it the same procedure that women would do in looking for lumps or anything like that?
So for men, I guess they won't be really looking for breast cancer because it's so rare. For women, we have diagnostic things like mammogram and ultrasound, and they get checked every time they go see a doctor maybe, but for men, this is not something that gets checked often. So if they see something abnormal, a lump in their breast, they should get checked up for this because breast cancer in men can happen.
And is it the same sort of treatment that most women would receive, or is it an entirely different ballpark?
It is the same actually. Because it's so rare in men, the treatments are pretty much based on what we have learned from women, the clinical trials that have been run with women and breast cancer. And we pretty much treat people the same way we do. We treat men the same way we do women, and we also refer them to plastic surgeon if they worry about cosmetic effects.
So everyone should be aware of it. Everyone should get checked.
Yes.
If in fact you think that you may have something abnormal, please, by all means, go get it checked out, correct?
Yes, definitely.
All right. Thank you so much for joining us today.
Course.
It's an issue that a lot of people don't really know about, and
Yes.
everyone should know about that. So
Definitely.
thank you so much for joining us.
Thank you for having me.